Okay, I'm just going to make my way over here.
It's neat, all the balances.
All right, Neil, so we're going to go through a couple stretches with the page.
Okay.
There was a huge need for physiotherapy in community. The whole idea is that we're providing care in First Nations communities so that people don't have to travel to receive that care. And in order to make it something that is sustainable and also going to be easy to, recruit staff and keep filled, because the vacancies in that area are a significant concern. What we're working on is like a hybrid model of care. So it is part in person and part telerehab.
How can we bring services closer to home? With the physiotherapy part of it was a huge component, because we've seen many community members that have gone through strokes, that have gone through heart attacks. How can we better assist them? Being in a rural setting, it gets difficult to bring professionals into rural areas of Manitoba or in First Nation communities.
What she's going to do is she's going to lift your leg straight up.
I was doing a little bit construction work and I hurt my back the first day, so me coming here really makes a big difference. I would have to make a special trip to Winnipeg to get the services that I get here, and then it's a whole day. I probably would not have went. I would have just sucked it up.
Yeah, so we'll do the other leg now page.
I'm able to visualize things. I'm able to see things that are going on with the patient. If something's starting to be unsafe, or if a correction needs to be made, for example, to an exercise I'm getting the patient to do, as well as I feel like it helps the patient as well, just because they're able to see a face and not just hear the voice. It makes it easier for people to get the care they need.
Activate it so it follows. So you just have to stand in front of it.
Physiotherapy is a service we've had very little of throughout our healthcare system. Whatever barriers are there, they prevent access, they prevent people from utilizing those services, and it leads to a poor overall quality of life. And we just want our people to age well. Technology has that ability to close those gaps that are existing in our healthcare system.
I have my issues are with my rotator cuffs now, because we swung those big hammers every day, and many times hours went by, and that put a lot of stress on the arms. And it didn't help when I was in a car accident, got thrown out of a vehicle, and then had back issues ever since.
You kind of grow into disability as we age, so it's incredibly nice to have that services now for our older community members. They'd have to travel, whether it's local or to Winnipeg, to access any of these services.
If you have the facilities in the community, you don't have to leave the community. It's the travel part of it. And having these people here helping the people in the community is a big sign of relief for everybody.
If this position is successful and the communities feel like they're really benefiting from having this hybrid model of care, then we could look at expanding it to OTs, to speech therapists, to be able to provide more services in community.
And just back and forth.
It gives me more confidence in myself knowing that I have these services here to help me.
My hopes for the future in terms of community health for our nation is to continue providing and enhancing services closer to home, whether it be bringing a personal care home, increasing more mental health supports, children and youth programming in our community. I think that virtual care is probably the way to go.